Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. Down syndrome patients have needs that other patients simply don't have, and the Down syndrome program at UMass Memorial Medical Center caters to those needs.
The Down syndrome program is a resource for personalized care for patients and their families. When I started in the role of the nurse coordinator, what I did was I contacted the Massachusetts Down Syndrome Congress, also known as the MDSC, and we went through possible numbers of what Western Massachusetts looked like versus Boston. And so with their database, without giving any patients' names, we were able to come up with that there was a need in Western Mass for about 500 to 600 Down syndrome patients. What we found with the numbers were that some people were still traveling into Boston versus not being seen at all. And then we were also not capturing any transplants into Massachusetts, people moving in from out of state, or even northern Connecticut or Rhode Island.
Why did UMass Memorial dedicate a clinical center to Down syndrome patients?
We decided to create the clinic because there was a lack of resources outside of Boston for kids with Down syndrome. In Boston, they have 2 centers, nothing west of 495. We basically started with a handful of patients, and now we're already into triple digits and hoping to obtain more.
What is the benefit of such a program for families with a Down syndrome child?
They have me, first of all, I'm the coordinator. So they have me as their point person into the hospital system. So not only do I get them their appointments with the different specialists on one specific day, or multiple days depending on their condition, they also have a place to get resources outside, so non-medical, so educational resources, resources out in the community that we're linked with. So we do a lot with Massachusetts Down Syndrome Congress, and we hook them up with them, along with just, making sure that they have the resources for the families.
What is unique about a child with Down syndrome that requires so many visits with specialist physicians?
I do believe that some Down kids have more medical needs than others, and therefore we can kind of hone into what specialists they need, and then that they don't feel lost in the system. Central scheduling, or whoever they call into, calls me, and then I make all the initial contact with the families. I talk to them about what their needs are, what they feel like their needs are, what they have, what they don't have already, and then book them with their doctors and their doctor appointments. And then I try to get outside resources with our social worker to get that for the families.
How does the child's primary care physician stay informed?
Our multidisciplinary clinic is about coordinating with all the different specialties, so everyone is up to date with what's going on with the child, whether it's medical or non-medical. As far as educational needs, sometimes that needs to be addressed because of behavioral issues. We do try to keep everyone informed as much as we can as far as the primary care physicians or even the specialist.
What changes have you noticed since the clinic began seeing patients?
I see that it's more organized as far as the patient care, and I also see a decrease in missed appointments. So once they know that they have appointments with maybe 2 specialists, they're there. Or even multiple. We've had one patient come in and see 4 or 5 different specialists. And generally, I believe that the families are much happier. All their needs are getting addressed.
What is your role in the Down syndrome program?
I'm their contact person, and I am able to answer their questions either by the answers of the doctors and then get back to them. I can get, whatever their questions are to the doctors, and that kind of filters everything, especially for their appointments. So if they have concerns ahead of time, we discuss them, I write them down, and then pre-clinic, we as a team go over every patient and any concerns that arise from phone calls previously or potential issues that could arise.